Well, good afternoon, everybody. Thank you very much for being here. Appreciate it. Again, part of our overall effort to continue to update everybody with regard to where we are on fighting the spread of the coronavirus here in our state. Later today, we'll be joined by Dr. James Lawler from UNMC. We'll also be joined by Tony Goins, who's our Director for Economic Development at the state of Nebraska, as well as Leon Milobar, who is with the Small Business Administration in Omaha, and they're going to be talking about the Small Business Administration loans. But as always, I always want to start off by reminding people how important it is that we continue to practice our physical distancing, our social distancing, the directed health measures that we have put in place here in the state of Nebraska. These are vitally important to fighting the spread of coronavirus. This is how we slow down that spread and make sure we don't overwhelm our hospital system. By making sure that we have that space available, we'll be able to take care of the people who will need that help, the most vulnerable people in our state, the people who are going to be older and have those underlying health conditions. That's what this is all about. So that's when we have issued these directed health measures that put restrictions, for example, on the 10-person rule, no public gatherings larger than 10 people. We do that to slow down the spread of the virus. We have directed health measures now in 12 of our 19 public health districts. And that includes 56 counties, and over 87% of our state's population is under those directed health measures. And those directed health measures that we've been taking, again, washing your hands for 20 seconds right after you eat, right before you eat especially, but wash your hands often for 20 seconds and especially wash them right before you eat. Making sure that you're keeping that physical distancing of 6 feet. Making sure that you're staying away from somebody who is obviously sick. Making sure that if you are sick, and when I say sick, I mean that you've got those flu-like symptoms like a cough, shortness of breath, fever, that you stay home, and especially if you're in one of our DHMs, or our directed health measure areas, everybody in your household stay home. Don't go into a clinic. Don't go to your doctor's office. Don't go to an emergency room. Call ahead of time. Make sure they can make arrangements for you to be isolated when you go in so that you can get the tests you need, like the flu tests, that you can be screened to see if you're one of those high priority cases to get our coronavirus tests. These things matter, and they work. In fact, today, Google has come out with some information with regard to how social distancing has been impacting our behaviors here in the state of Nebraska. And that's what these charts over here are about. What they did is they looked at mobility for Nebraskans, and they've done this for all the different states, with regard to where are you moving about. And so I'm going to kind of highlight some of this. Retail and recreation down 34% for the state of Nebraska. That shows that people are changing their behaviors. In fact, in Douglas County, where we've had our most restrictive measures in place for the longest, this number is actually down 41%. Grocery and pharmacy, down 9%. You can actually see it may be a little bit tough on the charts back there, but there were spikes around when people went to the grocery store, but now that's down 9%. Going to parks, up 109%. And one of the things I want to emphasize when people are going to the parks is that you still need to practice that physical distancing, that social distancing. So don't go to a park and play a team sport, a group sport. Right? That defeats the purpose of having groups less, 10 people or less. Don't go have a bunch of groups of kids playing together on playground equipment. Continue to practice social distancing. Keep the groups of 10 people or less, 6 feet of distance in between you. It's great when the weather's nice to go out and go to a park, but you got to make sure that you're doing the right things with regard to the social distancing. We've got to continue to make sure we're staying committed to that, especially this month. Look, April is going to be a tough month. This is going to be a tough month for Nebraska. We've got a long road ahead of us here. It's only April 3rd. So we must continue and stay committed to these social distancing practices. Over here, we have a couple of other data. One in transit stations. Again, this would be an indication of people commuting, down 18%. Maybe not quite as impactful here in Nebraska as maybe New York City, but still an indicator that people are changing behaviors. Visits to workplace, down 24%. This is what we want to see, is that we're encouraging employers, let people work from home. If somebody shows up sick at your workplace, you must send them home. If they've got that fever, that new cough, shortness of breath, make sure you're sending those people home. We cannot allow those people to work and potentially infect other people. And then residential is up actually 8%, showing that people are staying home more. Now, these are new baseline data that we have here, but this is part of what we can use to be able to say, folks, we've got to be able to continue to focus on this, and we know we all can do better. We know there's ways that we can improve on what we're doing to limit the amount of social interactions that we have. Again, when you're talking about going to work and just, coming back home. Go to work and come back home. Avoid any unnecessary trips. We talked yesterday about the grocers. Okay, one person in your family goes shopping. Make a list ahead of time so you can be efficient. Get in, get out, and only do it once a week. That's some of the ways that we can limit, again, those trips out of the home and make sure that you're spending more time at home. That's part of how we can make all of this happen. I also have mentioned some of the data that we've talked about with our Department of Transportation, that overall statewide we've seen that our transportation numbers, our road counts are down 29%. In Omaha it's down 28%. In Lincoln it's down 32%. And this, despite the fact that truck traffic has stayed relatively constant. It's down a little bit, but not that much. That shows people, again, are changing behavior. And of course, one of the things we've been monitoring is how many people test positive. So we've talked about that. If you look over the last 4 days, if you go over the last 5 days, we had a positive count of 25 people, and then it jumped up to 37, then 38, then 36, and then today at noon was 33 new cases, day over day from yesterday at noon. So it's a positive sign that we've got a flat number of cases over the course of the last 4 days, and that's with increased testing. So on March 31st, we tested 404 people. On April 1st, we tested 696 people, and yesterday we tested 671 people. So an over 50% increase in the number of people testing, yet the number of people testing positive staying flat. So that's a positive sign. Now, ultimately what this is about is making sure that we keep people out of the hospitals and don't overwhelm the hospital system. That's what our goal is, to make sure we've got the capacity to take care of those people that are going to need our help. That's what we're going to be really focused on. So we've been putting the things in place with regard to our directed health measures and the 10-person rule, following the CDC guidance and all that sort of thing, as part of our overall Nebraska plan to be able to slow the spread of the virus here in our state. And again, we have some of these indicators that people are changing their behavior, always an opportunity for us to do more, and we've got to stay committed to it. But we are seeing people change their behavior, whether it's in the Google data, our transportation data, the number of people who are testing positive. We'll be looking for additional measures we can look at to see, again, how are we doing with regard to our hospital system. But one of the people that's helped us craft this plan is Dr. James Lawler from UNMC. And he's going to come here and just talk a little bit about why it's so important that we continue to follow this plan, how it's put together, and so forth. And of course, he'll be available for questions and answers when we get to that stage. So with that, Dr. Lawler, I'm going to go ahead and call you up and ask you to say a few words.
Thank you, Governor. Good afternoon. We at the University of Nebraska Medical Center are here, obviously, to offer our expertise in infectious disease and public health for the state of Nebraska to help keep us all safe. And I think it's important to recognize that we also share everyone's concern about the current pandemic, which is really an unprecedented event for all of us in our lifetimes, and recognize that these are sometimes frightening times, but that we are all doing our best to try and assess where we are and what we need to do to keep all Nebraskans safe. A few points that I think are important to keep in mind as we move forward. First of all, we're still very early in this event. We're in the second inning of this game, so to speak, and we are going to learn more. But unfortunately, in our state, as in others, we're going to see more cases and, unfortunately, more deaths. And so I think it's important for everybody to recognize that and understand that when we see that happening, we know that that's our projected course. I think the second thing to keep in mind is that while we are increasing our testing capacity, and over the past week have really seen a significant expansion in our ability to test and get information. We need more information to be able to understand how well we're doing with our non-pharmaceutical interventions, the tools that we're using to keep the epidemic spread to a manageable level, and need to understand how to analyze those data more effectively to make the best decisions about those best interventions that we need to take. And the third thing is to keep in mind that really the name of the game here is all about preserving the healthcare system to be able to provide effective healthcare to all Nebraskans. What we're seeing in areas such as New York, which obviously had a much bigger head start in their epidemic than we did, is now the health system has become overwhelmed, and those healthcare services now are not only difficult to get for patients who are infected with the coronavirus, but for everyone, and that's what we're really trying to avoid here. It's important to know that again, this virus is here to stay. We're not going to be able to get rid of it. We really won't be able to return to a complete normal until we have a vaccine. But what we can do is keep the epidemic curve in our communities at a level that's low enough that we preserve the healthcare system and we maintain that ability to provide high-quality healthcare for everyone. So again, these are certainly anxious times, and obviously we're all doing our best to manage, but I think when we think about the prospect of how this is going to play out, some of the tools that the governor pointed out here really do offer hope. It's been amazing to see how the private sector and the academic sector and public sector have begun to work together to really develop new innovative solutions to allow us to understand how best to manage the epidemic and give us great new tools to be able to get the information we need to do that. And that has been something that, to me, has been really inspiring. So while this is unprecedented in terms of the disease and the challenge that it's presenting to us, I think our efforts to counteract that have been unprecedented, and it's really been inspiring to see the innovation that's being brought to the table really every day. And so I would say that that's a word of encouragement that folks can take away from today and understand that we have the best and brightest helping us here to find answers to our daily challenges. Thanks.
So, Dr. Lawyer, would you just like to talk a little bit about why doing all these things are important, kind of that Swiss cheese analogy?
Sure, absolutely. So, as everybody recognizes, there have been a number of different pieces that have gone into these social distancing measures that we're taking. One is obviously closing schools. That happened relatively early, and schools are probably in any community the most densely concentrated group of people anywhere in any community. It's interesting, in the U.S., more children ride a school bus to school every day than all adults who take public transportation. And if you look at the density in classrooms, there's nowhere where we have as much mixing of people and opportunity for respiratory viruses to transmit in schools. So that's why schools and closing schools is an important component. The second thing is some of the interventions we've taken around home isolation of people who are ill. So people who are ill really need to stay home, and quarantine of close contacts of people who are ill, so family members staying at home. And the last thing is a lot of these other social distancing measures, eliminating large gatherings, implementing social distancing in workplaces, closing restaurants only for takeout. All of these things essentially limit the ability of a respiratory virus to transmit from person to person. It's really all about, how often are people coming in close contact with each other, and how long are they staying within that close range. If you can eliminate or minimize those interactions, you really significantly limit the virus's ability to transmit. And all of these things are imperfect solutions, obviously, but when you put them together, as the governor said, they are like layers of Swiss cheese. They all have holes in them, we know that. But when you start to layer them one over the other, those holes kind of disappear as you get really a synergistic effect. And so all of these things together really can have a profound impact in disease transmission in the community. We've seen this certainly with other diseases, and now we're seeing that play out in many countries that have already taken aggressive actions and have seen their epidemic curves dramatically decline.
Thank you very much, Dr. Lawler. So again, as Dr. Lawler was saying, it's important that we continue to follow all these measures. We've taken some of the steps, like with the schools. You're standing a little close to me, Dr. Lawler, I'm just saying. Thank you, 6 feet, yeah, okay, good. So, so we've been taking steps like, again, the schools are operating without kids in them, right? So we don't have any kids in the classroom. That's why, again, we emphasize when you go to the park, don't have a bunch of kids playing together. That defeats the purpose of not having them in the classroom. But that's one of our steps, and then you layer that on top with a 10-person rule in public gatherings, the 6-foot rule as far as interaction between people, keeping 6 feet distance from somebody else, washing your hands frequently for 20 seconds at a time, making sure you stay home when you're sick and everybody in your household stays home. It's these layer upon layer upon layer that creates that barrier for the virus to spread, and that's why we can see that retail and recreation is down 34%, right? That people going to workplaces down 24%. It's about making sure we change that behavior that allows the virus to spread. And again, folks, I want to go back to the line I used yesterday from Coach John Cook. If you want to see football playing this fall, you better be staying home right now. And if you're a high school senior and you're planning on having a graduation maybe in August because they're pushing that off, if you want to see that graduation in August, you better be staying home now. That's the message we need to get out to people. Look, if you want to see us to go back, and again, to Dr. Lawler's point, we're not going to go back to normal. It'll be a new normal, especially until we get a vaccine. But if you want to get back to some place where we can do these type of activities, you got to stay home now. So that's really the message we want people to know is if you think you want to have that high school graduation in August, stay home now. So thank you very much for that. Now, as one of the things we know, we have been severely impacted here in the state of Nebraska as we have across the country with regard to, because we're asking people to stay home and, retail and recreation is down 34%, that means many of our small businesses are being impacted, especially if you are in that restaurant or retail sector. And so as part of the recovery efforts or part of the response efforts, the Small Business Administration has been working to be able to provide liquidity, i.e. capital or loans, to small businesses to allow them to continue to stay in business. They've got 4 basic programs that they have rolled out to be able to help small businesses. And today we've got Tony Goins, who's my Director of Department of Economic Development here in the state of Nebraska. And then, as I mentioned, Leon Milobar, who is with the Small Business Administration in Omaha, to talk about those programs and what small businesses can do to be able to continue to be operating, staying in business, continue to retain their folks as we go through this public health emergency. So with that, I'm going to go ahead and ask Tony to come up, and okay, we're going to do good social distancing. You're going to talk first, yes. Then we'll have Leon come up. Yes. All right, great.
Okay, first of all, Governor, thank you for your leadership during these tough times. I often say it's easy to be a leader when things are going well. You find out who your real leaders are during tough times, and I want to thank Governor Ricketts for his leadership and for standing up for our state and for the citizens. It's a simple fact that public health measures are making day-to-day operations difficult right now for all sorts of businesses. Restaurants, bars, lounges, theaters, hotels, gyms, salons, and Main Street. We recognize the greater good. First and foremost, we have to protect the lives of our Nebraskans. And then we'll work together to ensure their livelihoods. On behalf of the businesses here in Nebraska, I want to express my heartfelt thanks and appreciation to Dr. Antone, the public health team here in the state of Nebraska, and the medical community in our state. They're doing an heroic job right now to keep Nebraskans healthy and safe. As Cornhuskers, we're all in this together. And you've heard me say it before. We all wear the same jersey. And we're going to win this war as long as we continue to do what's necessary through the CDC guidelines and the guidelines that the governor set forth in the state. We're going to win this war on this virus. So let me talk about some relief and assistance for businesses. At the state and federal level, leaders are working hard to provide relief to businesses, whether big, small, or self-employed. In this season, Nebraskans, you've heard me say it before, we need to communicate and we need to work together as much as possible to accommodate each other. So here are some practical steps that I've talked about before. First, if you're a small business, you contact your vendors that are associated with your business. Every business owner should print a list of their bills, including vendor invoices, and make payment arrangements. This does not negate your responsibility to make payments, but everybody understands as your revenue drops, some level of accommodations are necessary. Second, bank loan deferments. The Nebraska Department of Banking and Finance has been encouraging bankers to be supportive in accommodating their customers during this crisis. So you have the opportunity to have your loans deferred and to do so in a manner that says that it gives you some level of reprieve as you're going through this challenge. Next, rent deferment. It is obvious that if revenue drops, then it's going to be very difficult for you to make your rent payment. So in the spirit of ensuring that the business survives long-term, commercial property owners are strongly encouraged to consider some form of rent repayment reduction and some form of deferment for 90 to 120 days. And if a commercial property owner has a loan with the bank, you have the opportunity to talk with the bank to get a deferment, and then you pass that along to your tenant. My partner and peer commissioner, John Albin, has talked about the Department of Labor, the short-term comp program, and that is put in place in order to keep hours on the books while giving your employees the opportunity to have some level of unemployment. On March 27th, President Trump signed the CARES Act into law. And this was a $2.2 trillion stimulus that is designed to sustain us through this pandemic and rev up the economy once the coronavirus outbreaks ends. So here are a few features. I'll talk first about what is available to all employers. First is the payroll tax deferment. Delays of payment of employer payroll tax between now and January 2021. And this is a 50% of those taxes that are due on December 31st, 2021, and the other 50% will be due December 31st of 2022. So you can defer those taxes and you don't have to pay them back. First payment, December 31st, 2021. Second payment, 50% December 31st, 2022. Next is the Employee Retention Credit. And this is a credit available to employers fully or partially shut down by the government order due to this pandemic. It's also available to businesses that have seen a 50% drop in gross receipts. It's a refundable tax credit of 50% of the qualifying wages, including health plan expenses paid by the employer up to $10,000 per teammate. Wages paid after March 12, 2020 and before January 1st, 2021 are eligible for this credit. Next, I'll give a brief overview of this is available to small businesses, self-employed, independent contractors, and nonprofit agencies. So, the first, you've heard a lot about the Payment Protection Plan. It can be taken out for 8 weeks of a business's average payroll or $10 million, whichever is the lesser amount. The loan may be fully forgiven. It is actually converted to a grant. And if it's used to pay for payroll, and that's salary and wages and tips, benefits, sick leave, medical and or retirement, state taxes assessed on compensation, rent or mortgage interest, and utilities. Note that at least 75% of this forgiven amount must go towards your payroll. Loan payments will be deferred for 6 months. The interest rate now is 1%. Yesterday, it was a half a point. They improved that for our community banks, or for all banks, up to 1%. And this program is open through June 30th of 2020. There's no requirement to look for credit elsewhere before applying for this loan. There's no need to put up any collateral or make any personal guarantees for the loans. Businesses are encouraged to contact your current bank, and Leon is going to talk about the activities that are happening with current banks right now, and that's the first step to apply. Small businesses and sole proprietors can begin applying today, and independent contractors and self-employed individuals can start to apply on April 10th. And lastly, I'll talk about the Economic Injury Disaster Loan. I've talked about that before, and that's available to small businesses and nonprofits with fewer than 500 employees. This includes sole proprietors and independent contractors. This provides up to $2 million of working capital, long-term repayment up to 30 years. The interest rate is 3.75%, 2.75% for nonprofits. Payments are deferred to up to 1 year. As a part of this, you can apply for an emergency grant of $10,000 when applying for the loan. This grant may be available even if your loan is declined. The SBA has stated that they can fund this loan in 3 days, and the grant can be used for payroll, sick leave, rent, and whatever else you need to make that for. And this is an emergency grant, and it does not have to be repaid, is what the bill states. So listen, in closing, if you have questions about these programs, feel free to visit the COVID-19 resource page at opportunity.nebraska.gov. You can also call our business support line at 1-800-426-6505. The state of Nebraska will continue to keep you informed on relief for businesses and additional information as it becomes available. The rest of this month is going to be pretty tough for the U.S. and for our state as this virus spreads. In hard times, remember that we often have to find power in solutions, and as long as we continue to communicate and cooperate, we can win. In times like this, we have the opportunity to display our leadership, our flexibility, and our willingness to temporarily sacrifice for the greater good of the state and for our citizens. We are Nebraskans, and throughout our history, we have shown resiliency that has allowed this state to not only survive, but thrive during tough times. We saw it last year during the floods, and I am fully confident that we'll see it again as the months move ahead. Thank you, and I'll turn the platform over to Leon Malabor to give additional information about the SBA. Thank you.
Governor, thank you. Tony, Director, Nebraska Economic Development. This is a sure pleasure for me to go ahead and be able to speak to you today. I'm one of the individuals typically on the other end of the phone when you call the SBA district office. This is a monumental effort on our part to put out within the next 90 days $350 billion. We work closely with the Treasury Department, our administrator, Jovita Carranza, and administrator, the treasurer, to make all of this happen. We put this together in less than 7 days. Our process, SOP, went out last night. I haven't had a chance to read it. I'll admit that. One of the things that's important to remember what we were doing here in Nebraska, we have about 46,000 small businesses. 36,000 of them have 1 to 20 employees. We are, the fastest way to get money out to these businesses is through our community lenders, and we've been working with the Nebraska Bankers Association, a number of our trade groups, the credit union, the Nebraska Association of Credit Unions, and a number of other nonprofit organizations to help us get the message out regarding this program. What is interesting so far today, we launched it this morning. Here in Nebraska, we're up to about 200 loans per hour. This morning, we did more loans in the 4 hours than we would do in a year. So that's the growth rate we're seeing at this time. And we're hoping that everyone will be able to take advantage of this. This morning also was announced or was communicated with us, we're also including ag producers. This is something new. We've already talked about the nonprofit groups that are available to go ahead and participate in this. If you have, anyone has a question about our nonprofit participating, we suggest that they contact the Nonprofit Association of the Midlands, and they can help them determine if they're eligible for this program. Tony did a wonderful job of laying out many of the requirements that we have. One of the things I tell everyone to go ahead and do, go to our website, sba.gov disaster, and take a look at what we have there. It lays out both of our disaster programs. One, the payroll protection program, and the EIDL program, which is the Economic Injury Disaster Loan. This will help you understand what is available to you. The other thing about going to that, and I'm telling many business owners, especially if the larger business owners, to take a look at both programs to see what financially suits their business best. You can only take out one program. There cannot be a duplication of funds, so to speak. No duplication of loans. If you have multiple businesses, you can take out a loan for each one of them. We are concerned about some affiliations, though. One thing that we do is we do have a science standard for the payroll protection. It's 500, but there are exceptions to that, and exceptions are restaurants, hotels. And there are a number of other franchises that we've looked at too that have 500 employees. Personally, I've worked with one organization here in Lincoln that has 650 employees. They're a franchise. There were multiple franchises, and so we provided technical assistance for them. It's important to also consider the documentation. One of the things we're telling individuals that are going to apply, talk to your accountant, your CPA, or if you got a CFO, to go ahead and determine which loan program is going to work best for you. The PPP program is the quickest to the money. We believe our lenders, we are been told that our lenders have indicated it takes 20 minutes or less to put a program in, an application into our system, and we're hoping a 24-hour turnaround, and then it's up to the lender to go ahead and finish the documentation and to get the money into the individual businesses owner's pocket. One of the other things I like to talk about is deferrals. If you currently have an SBA loan, United States government, Treasury, we are going to pay for 6 months of your principal, interest, and fees that are associated with that loan. We're hearing from many business owners this is probably better than our loan programs. So we think that's a wonderful opportunity. There's also for those individuals who have a disaster loan. We are deferring that loan for 6 months, so hopefully they can recover. One other aspect what we were talking about, that we only say one loan at a time. If you have a disaster loan associated with a previous disaster incident, you can go ahead and apply for the PPP loan. This is a totally different disaster. So this is one of the other things. We're hoping that, and if anybody has any questions that they feel to reach out to their lender or to us, we are addressing a number of issues that are ramping up this. As I said, we have $350 billion. We were given a little over 7 days, not quite 7 days, to go ahead and ramp this up. We also were told that there will be some programmatic changes in terms of how the lenders were going to head and apply for the loan within our system. So even as with the virus and all this, please prepare. The information is on our website. And if you have any other questions, please feel free to call your lender, or please email or call the district office. Our phones have blown up, but we know we'll recover. Thank you. Great. Thank you.
Thanks, Leon. And especially that point you made about after the flooding we had last year, some companies may have that SBA loan from last year, but they're still eligible to apply for the SBA loan this year because the coronavirus is a new disaster, so they can have both. So thank you for that clarification on that. And then I also, Tony, you mentioned opportunity.nebraska.gov as a place to find information. I believe the U.S. Chamber also has a checklist for businesses. Is that uschamber.com? Right? I believe that's if you go to uschamber.com, they also have a checklist for businesses as well. So, yeah, thank you very much, both of you, for being here. All right, so we have a couple of other things we want to hit upon. We talked about the SBA loans. Yesterday we had John Albin here talking about the unemployment loans. We actually last week issued nearly $1.7 million in those unemployment paychecks. That is obviously represents like something like 4,448 weeks of unemployment, including some folks getting more than 1 week from that disbursement last week. So again, while we haven't kept track of this specifically, I gotta believe that's a record for what we've ever done, given where we are. We've had questions about, again, we're getting back talking about the social distancing. We've had questions about drive-up churches. So can we have more than 10 people drive up to do a church service? And the answer is yes, as long as people stay in their cars and you don't do anything that would kind of defeat the purpose of having smaller groups, right? So no passing the plate, no sharing of songbooks or passing those around to cars, no Eucharist, things like that. You can't have those shared from car to car to car because that defeats the purpose. But if it's coming, driving up, everybody stays in their car and watch the service there, absolutely appropriate. So we've had a number of questions about that. We've talked yesterday about Coach John Cook, who did a little tweet out talking about, again, following the social distancing. Coach Hoiberg did the same thing, so I want to give a shout out to him and say thank you very much for doing our PSA and doing a video about why people need to continue to practice our social distancing. That's important. Also, at the state of Nebraska, we applied to the CMS, the Center for Medicare and Medicaid Services, for an 1135 waiver. What this is this is a waiver during emergency times that allows us to waive regulations to make it easier to continue to provide services through Medicaid and not necessarily follow all the regulations that would apply in normal times. We found out yesterday that we received our waiver back from Medicaid, from CMS, on that 1135 waiver. The Surgeon General has been talking about when you're going through these special times, please continue to make sure you're paying attention to your mental health. That we all experienced here in Nebraska last year with regard to the flooding that we had. If you do need help and want to talk to somebody, there's a suicide prevention line. That number is 1-800-273-TALK. So you can reach out and talk to people that way, 1-800-273-TALK. There's also, the Nebraska Family Services has a line, 1-800-866-8660. So 1-800-866-8660 to be able to, again, reach out and talk to somebody. Please make sure you take care of your mental health during this time, just like you would take care of your physical health. We're talking a lot about physical health. Mental health is just important. Yesterday, we talked about Innovation Campus and what Shane Faradar is doing there with regard to making those plastic face shields. He is also looking at manufacturing gowns, and so is looking for materials for that. Again, you can reach out to Innovation Studios at unl.edu. So he's planning on making gowns as well. And, all right, Taylor, where'd you go? He is looking for house wrap. So I don't know how house wrap helps him make a gown, but I'm not that familiar with it, but apparently that's important to be able to do it. So if you've got house wrap and you want to have it and you want to donate it to Shane, he can turn that into gowns to help out our healthcare workers, our hospitals, and so forth. So please, if you've got that house wrap and want to donate it, email innovationstudios@unl.edu. One of the other industries that's been impacted by this emergency has been the dairy industry. Obviously, with schools operating without students and restaurants being closed to dine in, there's been a lot less demand for dairy. And so the Nebraska State Dairy Association and Midwest Dairy Association are working to find additional demand for that. Actually, raw milk had to been dumped because of the lack of demand. I think 100 or so truckloads across, or 100 loads across the Midwest, 11 here in Nebraska. But the folks at the State Dairy Association are working to be able to find new markets for that, working hard to be able to overcome that disruption to what would normally be the supply or the demand that they would have for their industry. And then also I want to talk about, again, companies doing the right thing. Target is one of those companies that has really been stepping up to be able to do the right thing here in our state. One of the things that they've announced is starting I think on April 5th, they are going to be making sure that they limit the number of customers that are coming into their facilities, making sure they're putting down, again, they've already been doing things like putting down tape on the floor to keep customers 6 feet apart or more. They're putting up plexiglass by their cash registers, sanitizing their stores. They are doing a lot across all 1,900 of their stores and distribution centers across the country to protect their customers and their teammates. They're also going to be issuing surgical masks and gloves to their teammates to be able to help make sure we're protecting everybody in those stores. But again, another example of how companies are stepping up to meet the challenge of this emergency. So thank you very much to Target for what you're doing. And with that, I'm going to go ahead and now go over to our questions that were emailed in. So I'm going to start with Matt Wiesner of NTV. I just took a call from a viewer asking about health insurance. He was wondering what Nebraskans need to do if they lose their health insurance due to being laid off because of the virus. He would like to have the governor speak about this in the press conference tomorrow, that's why we're here today, pointing out how expensive COBRA insurance is and how someone who has recently laid off would not be able to afford it. He went on to say that if someone did get the virus and ended up in the hospital, obviously that could be very expensive. So one of the things I think in the CARES Act that we have is that for folks who become unemployed or uninsured, that the CARES Act will be addressing that specifically. We are still waiting to get some of the guidance from the federal government with regard to how that will all be implemented. But that is actually one of the things, is to make sure that nobody who needs to get that coronavirus test will be charged for it or pay a copay. Nobody who needs to get cared under that will have to worry about the insurance because they'll be covered under the CARES Act. Next is from Ellis Wiltsey from KOLN. What is the state doing to enforce child custody? We've gotten several calls from viewers saying that some parents are abandoning their custody plan and there is nothing they can do to enforce it. What are other states doing and what are we doing to implement it here? So again, folks, on this one, we're probably going to have to get back to you on this one. I don't have an answer for you on that right now. Obviously, we need to continue to enforce that child custody, but being able to, you still got to do it, folks. If you've got an arrangement with your ex-partner, you've got to be able to make sure that child still goes back and forth between those homes. You've got to be able to make sure you find a way to do that. So I encourage you all to do that, and we'll have to just get you more information with regard to how we're enforcing this. So those were, I believe, Taylor, the two questions. Oh, wait, no, take it back. Got one more underneath here. Okay. Grant Schulte at the Associated Press, do you have any sense of what this is doing to state revenues? We really don't have a good sense of what this is doing to state revenues. Obviously, this really started impacting us in March, and we will release March revenue numbers this month by April 15th. And of course, we know that the deadline for filing taxes has been pushed from April 15th to July 15th. We are asking Nebraskans who are not impacted by the coronavirus to still file the taxes by April 15th. That's going to be important for everybody to do if you can. But obviously, if you have been impacted, then please take advantage of pushing it back to July 15th. Now, if everybody in Nebraska pushes back their taxes to July 15th, that would be a move of $385 million from this fiscal year into the next fiscal year. We do believe we can manage that within our resources we have here at the state of Nebraska, leveraging things like our cash reserve and so forth. So we will work to manage our cash flows, but we know this is going to have a significant impact on our revenues going forward. So while we may not see it in the March numbers that come out later this month, we certainly would expect to see it in the April numbers that would come out in mid-May. All right, Taylor, did you have anything else that was texted in?
Yes, we have several questions. Alexandra at KTV says, we heard today we won't get back to normal until we have a vaccine. But we're hearing that could be a year away. What does this mean for people? Will there be an easiness on the DHMs before a vaccine comes out?
So Alexander of KMTV was asking, so we heard that until we get a vaccine, it's not going to go back to completely the way it was before. There'll be a new normal, and that means that we will continue to have to do things like doing the social distancing and so forth. A vaccine may take a year and a half, and Dr. Lawler, I'm going to ask you to come up here and make a few comments on this. I'm going to go ahead and wing this, and then you can come up and say, no, Governor, you got that all wrong. But what we should expect to see, though, is that as we reach the peak and as we get the virus under control, we will see a loosening of these restrictions. I cannot tell you what those will look like, but at some point we'll gradually start loosening these restrictions and see what happens with the spread of the virus here in our state. And so we will see some of those things happen, but I think, again, until you have a vaccination and make sure that everybody can be protected, we are going to have some level of awareness about making sure we're doing all the same things we've been talking about, like washing your hands frequently for 20 seconds at a time, the social distancing and so forth. So, Dr. Lawler, I'd ask you just kind of expand upon that just a little bit more.
Thanks. And I think what the new normal looks like will depend a lot on the tools we have to be able to assess where disease prevalence is in the community and how our different interventions are impacting that disease prevalence. I do think that ability is getting better every day as we get more testing for actual infection. And then hopefully soon, within the next few weeks to months, we'll be able to get serologic testing online as well, which means we'll be able to look for antibodies in people's blood that indicates that they've had the infection and that now have some level of immunity for some period of time. And that will allow us to be able to use that information to put those people back to work in potentially positions that are at greater risk, and also to understand that the non-pharmaceutical interventions that we're doing really need to account more for the people who are potentially susceptible and could get infected, whereas those people who have immunity and antibodies can be relatively protected. So again, we're going to learn a lot more about what information we have and how we can use that information to fine-tune those social distancing and other non-pharmaceutical interventions that we're using. And I think that capability will get better and better as we move into spring and summer.
Thank you, Dr. Lawler.
We have a question from Michael with the Dakota County Star. I have a small business and put in an application for the $10,000 grant yesterday, and I was told this morning that I have to reapply because the SBA put up new paperwork this morning. Is that true or not?
So Leon, I'm going to ask you to come up and address the question from, I'm sorry, where did that come from?
It comes from the Dakota County Star.
Dakota County Star had a question about somebody who said, I put my paperwork in yesterday to get the $10,000 loan, and I was told I had to reapply today because the SBA has new paperwork. So can you address that?
Take advantage of that $10,000 immediate advance and all of that. We decided, first of all, when the initial application, there was nothing to address that $10,000. Again, we are trying to react what we see as necessary to help businesses out there. So we are asking everyone, and if you applied using the old forms, and we went and informed everybody that they needed to apply. You do not lose your place in line. You keep your same loan number and all of that, but this will help you take advantage of that $10,000. That's what we did. We are continuing to act based on various requests that we received from the public, and that's why we made that change.
So Leon, the short answer on that is yes, you will need to reapply.
Yes.
Okay.
Bill Shammer from 1011 says the biggest comment we keep getting is why isn't the state reporting about recoveries? Can you elaborate on whether there's a process to do that, or why hasn't it been happening?
Yeah, Bill Shammer at 1011 is asking, why haven't we been reporting on recoveries? And actually, Dr. Anton, I'm going to ask you to come up and talk a little bit about that. I will say the important thing we've been working on is really how are we making sure we do not overwhelm our healthcare system. Somebody who has recovered is not going to overwhelm our healthcare system. So that's why it's been a lower priority for us than, say, tracking people who are testing positive for coronavirus or figuring out how many people in our hospital systems are there because of coronavirus. So it's a lower priority, and again, unless we're collecting data to make decisions with it, it really is going to be that lower priority for us. But Dr. Anton, I'll let you talk a little bit about that as well.
So as of 12 noon today, we have had 279 positive tested cases here in the state of Nebraska. And of those 279, the vast majority have been treated as self-isolation at home. And we do have some hospitalized patients at this time, but the majority of those 279 people recovered. We just haven't kept track of the exact number. We know we have some deaths also, but that shows you that I think, and again, Dr. Lawler, you can correct me if I'm wrong, but 85, 90% of patients will recover on their own at home. So we will be able maybe to track those numbers as we get our epidemiology a little bit more refined. We'll be tracking the number of hospitalized patients and how many of those have recovered too. So that should all be coming out hopefully next week, where we'll track those numbers.
Thanks, Dr. Anton.
We have a few questions from Paul Hamill about prisons. He said he talked to someone who who's engaged with someone in a minimum custody prison, and she wants to know why her fiance can't serve out the rest of his sentence with an ankle bracelet.
So the question was for Paul Hamill, the Omaha World Herald. there's somebody in one of our minimum custody facilities who his fiancee is wondering why he can't serve out the rest of his term with like an ankle bracelet. Again, we are taking steps to be able to protect the folks that are in our correction system. For example, one of the restrictions we put in place is ending visits from people coming in from outside the facility for places like Tecumseh and NSP and so forth. But again, these are still inmates that have to serve out their terms, and so they still have to continue to serve out their terms.
He also wants to know, can you clarify why you don't support releasing inmates to reduce crowding like other states? He says that corrections records indicate that more than 40% of inmates were sent to prison were there for property crimes or drug offenses.
So Paul also asked, why don't I support releasing inmates? 40% have property crimes or drug crimes. Look, folks, you don't get sent to prison on your first offense. Many of the folks that are there have multiple offenses, sometimes 17 or more offenses. These are all folks that are there for a reason, and they need to continue to serve. And frankly, I don't sense among Nebraskans there's a big desire to let a bunch of people out of prison. Now, we are taking steps to be able to protect them, as I mentioned, stopping people from coming in to the visit and so forth, so we limit that opportunity for virus to get into our facilities. But I don't think Nebraskans, by and large, are thinking that letting out a bunch of people out of prison is a good idea.
Becca Costello from NET is asking you to confirm that the 10-person limit outside of the counties with DHMs is not enforceable. She says that Dr. Fauci last night also reiterated that most states are under stay-at-home orders. Can you explain Nebraska's relationship to those two things?
Sure. So Becca Costello from NET was asking about, hey, we got 12 of our 19 public health districts have a DHM where it's a misdemeanor to violate, for example, the 10-person rule. But in the other areas, it is a guideline that's been issued from the state, not under a directed health measure. So there's not that misdemeanor associated with it. The deal, folks, is we don't have enough police or sheriffs to send out people to everywhere in the state to get people to comply like we're, another country like maybe China could do, right? Here in this country, we really value our freedom, our constitutional rights, and frankly, what we need is people to voluntarily follow these guidelines, because we can't police everybody every minute of the day. And so, yes, we've put these guidelines in place, and as we've worked our plan with regard to, when we've had that community spread, we've issued the directive health measure that has other things in it besides the 10-person rule, like prohibiting elective surgeries and so forth. But in those areas of the state that are not covered by that, we still need people to follow the 10-person rule. And we've asked for local officials and law enforcement to help do that. And by and large, Nebraskans are doing that. That when you reach out to somebody who, you say maybe hasn't been following it, and you talk to them, they're often willing to comply. In fact, almost universally, we found that people do it. So we have seen, and you can look at these statistics here to see that people are changing their behavior, whether they're in a DHM or not in a DHM. And that's what we need to have happen, is people have to do this voluntarily, because we aren't going to have the resources for police to, sit at everybody's doorstep and make sure they're not having 10 people over for dinner or anything like that. So that's the reason why, again, we're trying to create a regional approach through our plan so that we can make sure that we're hitting the right time of when the virus is starting to spread, and that we don't get people tired of paying attention to these, and then they stop paying attention just when we need them to do it the most. So that's a big deal. And then the other part of Becca's question was about Dr. Costello and getting people to stay at home. If you look at what we're doing here in Nebraska, through our DHMs, for example, in Douglas County, they're very similar to what other states are doing. In fact, yesterday we pointed out that, in fact, we pointed out on her show last night, that in Florida, for example, where they have a stay-at-home order, we're actually more restrictive when it comes to things like religious events, where there's no restrictions on religious events in Florida, but our 10-person rule here in Nebraska still applies. Or if you look at what we're doing here in Nebraska compared to like state like Arizona, it's very, very similar. So we're taking a lot of those same steps. And again, we want people to stay home, right? We want people to go to work, come back and stay home. So that's what all this is about, is making sure we're encouraging that proper social behavior, and we are seeing that modification of social behavior. Now, do we have the opportunity to do more and do better? Absolutely, and that's why we're going to continue to talk about this message, especially as we get into April. This is going to be a very tough month. If you look at the models out there right now, Some of them say that we are going to reach our peak here in the month of April. We've really got to make sure that we are complying with these DHMs in every one of them. So we layer them layer upon layer upon layer to be able to slow the spread of that virus.
Aaron Duffy with the Omaha World Herald was asking you about JBS and cases that have been announced in Hall County. She wants to know of other factories that may have positive tests. Do we know of others? And she also wanted to know if we're weighing additional action against the JBS plant, or whether plants like that can continue to operate.
So again, who was the person that was asking that question?
Aaron Duffy with the Omaha World.
Aaron Duffy with the Omaha World Herald asked about the JBS plant in Grand Island and the number of positive coronavirus cases they have there. And in fact, I was actually just talking to one of their executives earlier today with regard to that specific plant and the steps they are taking to be able to make sure that they are keeping their people safe. JBS has got a facility there. It's part of the food supply chain. It is an important part of our food supply chain. It's an absolutely necessary thing that we have plants like JBS continue to operate so that we continue to have a strong food supply chain. Having said that, they also need to take steps like every employer needs to do to be able to keep their people safe and the community at large. And so in talking with the executive at JBS, he was talking about the steps they have taken. For example, in their lunchrooms, they put up plexiglass to create separate kind of areas for people to eat lunch so they can keep kind of that physical separation. They've had increased absenteeism, which has actually slowed down some of the number of people coming into the plant. They've taken other steps on the production line. They're sanitizing their plant and fogging it. So they're working on wiping down surfaces. So they're taking a number of steps to be able to make sure they keep that plant sanitized and to be able to separate the folks that got working there as well. So we've had the conversation with JBS. I think she was also asking about other plants. I don't have specific data I can share with you with regard to other plants at this point, but we are expecting all employers to take those common sense steps with regard to how am I protecting my teammates and how am I protecting the public. And again, specifically with regard to JBS, we had the conversation this morning about it, or just today sometime.
Andrew Mim with KGFW wants to know what models Nebraska is looking at, have peak projections changed, and is there a back-to-work plan being put together?
Andrew Mim from where? KGFW in Carmen. He asked about what models are we looking at and what does it say about where we're supposed to peak and so forth. Actually, we're working with the folks at UNMC. If you watched the NET show last night, you saw Dr. Ali Khan and I both on there. Dr. Khan's one of the folks from UNMC's Public Health that is working with us on a model. So we're looking at, there's also the model that's out there, healthdata.org, created by some Washington State folks. So there's a number of models out there that we're taking a look at and using that in conjunction with our specific hospital data to see what our peak might be, how many beds we might need, and that sort of thing. So I don't have any specific information I can share with you right now. We're still in the process with that. But that's the sort of data we are looking at. And Taylor's walked away, so I presume that means that was the last question we got in from text or emails. So we'll go ahead and open up now to folks who are here in the room.
When you look at this,
Yeah.
when you look at this Google Analytic data, I don't know exactly when you saw it, but was there anything in particular that you would like to see Nebraska doing better, or were you overall just happy with it?
Yeah, no, I think this is a good start, but definitely we'd like to see that number of 8% increase in people staying at home. We'd like to see that go up. Again, we want people to go to work and come home, right? And we talked about this on the shopping. Don't take the whole family shopping. One person goes shopping. Have a list. Be efficient. Get in, get out. Do it once a week. That's what we want people to, that's the way we want people to think. We know there's other business people have to take, but we want you to be thinking about going to work and coming back home and staying home. Martha.
How do you get people to stay at home? That has not been something that you've talked about a whole lot until now. And because there's not a stay-at-home order, then I don't know that people have gotten that message.
Well, again, we just got this data today. So Martha Stoddard from the World Herald asked a question. Gee, how are people supposed to know to stay at home, given what you just said about we want them to stay at home? You haven't talked a lot about that. Well, we just got this data today that shows that people staying at home is only up 8%. And so that's why we're really enforcing the or reinforcing the message about, hey, we want you to, go to work, but then come home and stay home. Because we think that that number should be higher, that if we see a decrease in retail and recreation going down 34%, people working at home down 24%, we think that we can bring that number of 8% increase in people being at home, we think we can bring that number up. So we just got this data, I think last night or early this morning, so that's why we're, talking more about people staying at home, but I think that's in line with what is the philosophy behind all of our social distancing measures, which is we want you to keep your distance from other people to slow the spread. That's why we have the 10-person rule in place, right? We want people to not congregate in groups of bigger than 10. If you stay at home, probably you're going to be able to comply with that. Yeah.
I took a call this morning from somebody who works for the state for state of access. She said that they've been deemed essential, but there's still hundreds of them working together, and she's worried why they have not been ordered to work from home.
So I'm sorry, say that again. Where's this?
State of access.
State of access?
She works for she works for the state. She just called it state of access. She works for the government, works for the state of Nebraska.
Yeah, I'm not familiar with that. But again, what we are trying to do at the state of Nebraska, just in general with our teammates, is we are working to have them stay home. But we also have essential functions that we've got to continue to deliver. And I want to again remind people that if you're working in an office setting and you're keeping that 6-foot distance, that's part of what we're talking about with social distancing. So finding ways to be able to continue to do our jobs, but make sure we take those social distancing guidelines and steps seriously by staying 6 feet apart, making sure you're washing your hands often, using the hand sanitizer that we have, making sure that if you are sick, you are staying home. And when I say sick, again, cough, shortness of breath, fever, all those sort of things. These are the things that will allow us to be able to slow the spread of the virus. And so we're not looking to discontinue our state operations. There's a lot of people who depend upon us. So, we've got obviously, I think over 12,000 teammates that work for us. So we got to make sure that we continue to provide the important services they provide, but also we're looking for ways to be able to have people work at home. As we mentioned, we have a few people who are on ready-to-work status, but we've got to provide those important services like, for example, what we talked about yesterday with our unemployment. We got to get those checks out. People need them. Yeah.
Hi, everyone. It's clear your stance on the stay-at-home order and kind of that opposition to it, and you're working with UNMC last month to make the plan. But if that 8% doesn't move to something more of a substantial of 15 or 20, where you're really seeing those people make that step home, is there an action that should be taken despite the message getting out there and no action being taken?
So the question is, basically with regard to hey, getting people to stay home and the 8% and getting people to do that more, are there other steps or actions that should be taken? And that's one of the things we'll continue to evaluate with regard to looking at the data as we have new data, seeing what we need to do to be able to make sure that we're getting better compliance. What are the measurements we're using to make sure we don't overwhelm our healthcare system? Those are all things we're going to continue to evaluate as we go into April. But the key thing is, there's not one silver bullet that's going to make this work. This gets back to what we were talking about earlier in that Swiss cheese analogy. It's layering all the steps one on top of another. Making sure, again, schools are closed, then layering on top the 10-person rule, layering on top the 6-foot distance from everybody, layering on top washing your hands often, laying on top staying home when you're sick. All those, it's the layer after layer after layer that we need to make sure that we continue to build so we create that barrier for the virus spreading.
What did the icing be on the cake just to order the steak?
Martha, I thought you were trying to put your hand up.
Yeah,
Okay.
didn't know if you were gonna answer that.
I'm not going to answer that one, no.
Given the number of people who have been laid off in the state and who have therefore lost their health insurance if they had it, does the state need to move up the start of Medicaid expansion to be able to help those people get access to health care?
Yeah, so the question was, given people being laid off, losing their health care, does the state need to move up Medicaid expansion to help them get health care? So a couple of things. One, if we were to change what we're doing for Medicaid expansion today, it would actually delay it past October 1st, probably to December, because we would have to rewrite all of our systems and so forth. That is a permanent program that we're putting in place, and if we were to change that, we'd have to go back to the Center for Medicare and Medicaid Services, first of all, to ask that permission to do it. If they granted us that permission, then we'd have to rewrite all our systems, which we are in testing with right now. So we're on track right now to meet our deadline of taking applications August 1st, rolling out the coverage October 1st. If we were to change that now, that would push it back to at least December, if not into 2021. So that's not a feasible option. However, with the new CARES Act, what is part of that is that everybody who doesn't have insurance is going to be covered under that. And so we're going to have to figure out a way to be able to provide that. But the CARES Act actually addresses that issue that we just talked about with regard to not having insurance. So the CARES Act actually anticipated that, and then as part of the coverage that you'll get for coronavirus specifically, to be able to get tested, get the treatment, all that.
Governor, I mean, I understand that you folks were working on a two-tier system, but you could launch a traditional Medicaid expansion. You already have approval from the federal government to add those folks into Medicaid, and you've talked about all these things that Nebraska's been able to accomplish by folks putting their mind to it.
So again, the question was, gee, I don't really get it. Why can't you just offer just basic Medicaid that the government approves already? Even if we were to do that, Martha, go back just to kind of a basic, to take what we have already, Medicaid, and expand it, we'd still have to go back and ask for permission. Okay, so you don't just get to do that. You still have to go back and get CMS's permission. When we put in our initial application in December, they said they'd get us approval in April. So that process was about 4 months long, and can you imagine going back to the federal government right now with this emergency? Now, maybe they could get that accelerated and it would be shorter, but they'd still have to give us permission. And even then, we don't have a system to enroll those people, Martha. That's what I'm saying. We have to build the system to enroll those people. We don't have any way to take them in. And what other states have done when they've rolled out prematurely, like California, they let people onto the system who didn't qualify. I think in California, they had $700 million every year they were spending on people they know didn't qualify for their Medicaid expansion, and another $400 million a year they were spending on people who they believed didn't qualify, but they couldn't tell for sure. So $700 million on people they knew didn't qualify, and another $400 million on people they didn't think qualified. If you put that together, it's over $1 billion they're spending on people that may not even qualify the program, thus taking away resources from people who truly do belong in that program. So we don't have a way to enroll those people unless we create a system to do it. That means software, that means working with our MCOs. So unless we actually go rewrite our software, and that would be part of what would take the time, that would push it past an October 1st, coverage and August 1st enrollment system, that's pushing it back maybe to next year. So it really isn't feasible. And we've put our project plan out there on our Department of Health and Human Services website. Let me tell you, Martha, not one person has come to us to say, oh, you can find a way to shorten your timeline here. Not one person has seriously approached us to say, I've looked at your project plan, here's where you can tighten this timeline up. Not one person.
We have time for a final question.
Yeah.
This is probably for Dr. Lawler, but understanding it's an imperfect science and a Swiss cheese approach, I kind of wanted to hear UNMC's decision on why
Sure.
10. The 10 was the right number as opposed to, presumably if it was 5 for the gathering limit, that percentage of fruit would be cut in half. Why 10?
Well, Dr. Lawler, why don't you go on up? Actually, when Dr. Lawler and I were first talking about this, he was saying 10 to 20. It was kind of a range, but the president kind of made the jump and going to 10. But Dr. Lawler, I'll ask you to talk about why 10.
And again, great question, and I think there is no exact science here. And so the strategy is to try and balance mitigation measures that will suppress transmission and reduce the opportunity of the virus to move from person to person. But obviously, to try, when you can, minimize the social impact. And so, families getting together with extended families on occasion, those types of scenarios that you can think of where, maybe more than 5 people would be potentially present in a gathering. And again, even these scenarios and in these settings, as the governor said, it's important to keep all of those social distancing concepts in mind, that if you're in a gathering with extended family members, you can still keep that 6-foot distance. You can still pay attention to hand hygiene and all of those other measures that we talk about to limit the opportunity to spread. So there's no magic about the 10-person number versus 5 versus 20. Seems like a reasonable compromise to make, but again, doesn't obviate the need for all of those other social distancing and hygiene measures that really are, those different layers of the Swiss cheese.
Great. Well, again, thank you very much, folks. Appreciate that. Taylor, we also will be making the announcement. We're going to be doing this again next week. Again, 2 o'clock every day, weekday next week. We'll continue to meet to update people on the state's efforts to be able to slow the spread of the coronavirus here in our state. Thank you to all the Nebraskans who are working so hard to be able to make sure we slow down that virus. When we see numbers like 34% down in retail, 24% down in workplaces, that represents a great step. People are changing their behavior. They are making those steps. But folks, we cannot let up. We need to continue to find ways that we can do better. The key to slowing the spread of this virus is making sure that we practice all those, what we call those non-pharmacological interventions, the NPIs, the social distancing, the 6 feet from each other, the washing the hands, staying home when you're sick, 10-person rule. All those things are those layers that help us create that barrier to the virus spreading. So please continue to do that. We've got a great start out. We need to continue to do more. So please continue to do it. I want to thank all of our Nebraskans who are doing it. And I want to thank all of our healthcare workers, EMTs, firefighters, first responders, all the folks who are working hard to be able to make sure we keep the public safe. Thank you for all your efforts as well. We've got a long road ahead of us, but we will get through this together. Thanks again, and God bless. We'll see you next week. Thank you, Gary.